letter of intent that's been agreed to by Beaumont Health and Advocate Aurora today. And it's about exploring and creating a regional organization to accelerate our ability to advance healthcare across the upper Midwest. The new organization would bring together the preeminent healthcare systems in Wisconsin, Illinois, and Michigan as a new organization and a new name that is yet to be determined. Beaumont, Advocate, and Aurora were talking at the end of 2019 and in early 2020 about this partnership. Our discussions were paused by COVID-19, but in no way are they caused by COVID-19. This announcement would have come sooner if we had not gone through the pandemic. In our organization, as we combine, our total revenue will be about $17 billion, and we will employ over 100,000 people across Michigan, Illinois, and Wisconsin. Advocate Aurora is a non-for-profit healthcare system, as is Beaumont Health, and was created in 2018 when the Advocate healthcare system in Illinois came together with the Aurora healthcare system in Wisconsin and became Advocate Aurora. It's the nation's 10th largest non-for-profit health system, and they have more than 70,000 employees and serve more than 3 million patients every year. Each of us has independently been fairly successful, and our organizations share a common and strong commitment to patient family-centered care and clinical excellence and top decile performance and quality and safety. But together we believe as a new organization, we can even be stronger in that effort. The new organization would also look to make new investments in Michigan that frankly we don't believe we can do alone. This would be significant investments in Beaumont's clinical programs, facilities, and technology, increased investment in the Beaumont Research Institute on the Royal Oak campus, financial commitment to be made to handle the bulk of the costs to potentially relocate the Beaumont School of Medicine we have with Oakland University from the Auburn Hills campus to the Royal Oak campus. This is subject to Oakland University review and approval, but it's something we've been talking about for a long time, and that this transaction we think will enable that to finally happen. We're obviously going to continue our construction of a mental health hospital in Dearborn. That's already underway. We have steel in the air on that, as well as our outpatient campus plans that we've communicated earlier in Livonia and Macomb County. Again, our goal on this is to grow market share for Beaumont Health and to have a bigger impact in Michigan. And by virtue of the synergies and the benefits of this combination, we think we'll be in a great position to do so. You know, we also recognize that many people have strong connections to Beaumont and are going to have a lot of questions. To be clear, here are some things that are not going to change. We're not closing any of our hospitals or reducing our services here in Michigan. Again, the transaction we believe will enable us to expand in Michigan, not to contract. We're not selling any assets. There's no money changing hands. This is where the Michigan Beaumont Corporation, the Wisconsin Aurora Corporation, and the Illinois Advocate Corporation would come under a common parent that is yet to be named, similar to the way Beaumont Health came together back in 2014. We do not anticipate any job losses as a result of the transaction. We are going to keep a corporate office as we have today in the Beaumont Service Center, and we're going to maintain a strong, growing presence in Michigan and continue to be a major employer here in every respect. Beaumont's name, brand, and logo will remain and will be, strengthened in our view by affiliation of the new organization. Again, if you go to Wisconsin, the brand used there is Aurora. If you go to Illinois, the brand there is used as Advocate, that have been there for decades. and obviously the Beaumont brand, even longer than Advocate Aurora, has been used in Michigan, and we're committed to that. The Beaumont Health Foundation will remain independent. Funds raised in Michigan will obviously stay in Michigan and be consistent with the donor's intent. This is a milestone in a process that enables us to announce it and expand the circle as we engage more people in planning on this. The deal is not finalized. The next step is to do a lot of due diligence, which both parties are doing, Advocate Aurora and Beaumont, with each other. A lot of plans are being laid out in terms of how do we go forward around certain initiatives, particularly around the patient experience. And then ultimately, once that's finalized in definitive agreements down the road, it would be turned over to the regulators for their review and approval by the state attorney generals in Michigan, Wisconsin, and Illinois, as well as the Department of Justice and others who have regulatory review over these kinds of transactions. So with that, I'm going to turn it back to Mark Geary, and we will stand for any questions you have about the information you've been provided to date. Thank you. Mark?
All right, I'll call on each, thanks John, I'll call on each reporter and I'll unmute you as we go. We'll start off with Robin Erb.
Hi, Robin, how are you?
Looks like we're having trouble with Robin being able to, let's try again.
Hear me now?
Yep, now we can hear you.
All right, my computer's being cranky today. I apologize. Could you tell me a little bit about how this began, who approached whom, and how this all worked out with your, when you were having the ongoing discussions with Summa Health?
Really, they're two unrelated items. The Summa Health, we elected not to go forward with that transaction. And frankly, both of the Summa Health and Advocate Aurora are merged in the middle of 2019 as a conversation. Advocate Aurora was fine with Beaumont Health going forward with Summa, and also fine that if we elected not to. The reason we did not go forward with Summa has nothing to do with Advocate Aurora. It really was, we were working with Summa on some changes we needed to make to the agreement between us, particularly related to the pandemic and the financial realities around the pandemic. Ultimately, we could not come to agreement on those, and we elected to not proceed with the transaction. The Summa people are great people, but again, totally independent of the Advocate Aurora conversation.
Okay. All right, we will move to Dave Herndon from the Dearborn Press and Guide.
Actually, my questions were kind of about the Summa stuff too, so he's already covered it.
All right.
Great.
Let's go to Kurt Nagel.
Hi, can you hear me?
Yep.
Thank you, Mark. How are you, John?
Doing all right. Thank you for being with us.
Yeah, thanks for taking the time here. So where will the new parent company be based? And do you expect this deal to create jobs in Michigan?
Well, one, in terms of the parent organization, we have not finalized where that will be located. Again, because Beaumont is so large, Advocate is so large, and Aurora, you have to have significant local management there. Beaumont will continue to have a CEO. Beaumont will continue to have a board, and we will continue to have a management team here. But we have not decided where the headquarters would be, but that will be figured out relatively quickly, I believe. but it's not going to be a giant layer over the three founding organizations. Our goal is to grow jobs here in Michigan, and we think that by being more successful in the market, we will grow the Beaumont Health jobs, and that's a great opportunity for us. It's also Michigan is a fairly efficient market for having support services too. So that may be another attraction for Michigan to pull, to even have more employment growth here.
Are there going to
I'm sorry about that, Kurt. Hang on. Go
not
ahead.
not a problem, just a quick follow-up. Are there any leadership changes planned at Beaumont as a result of this deal?
There's no changes at this time that we're announcing. And frankly, we're sorting a lot of that out. It's the Beaumont transaction is going to obviously mean certain amount of change for Beaumont, but it's also going to mean change for Advocate and Aurora. And so the leaderships now are really discussing that and say what will be the most effective structure to go forward with. But again, as I said, we will have a CEO here at Beaumont. I'm currently obviously in that position. We will have a management team continue to be here at Beaumont. And there'll be one in Advocate and Aurora too.
All right. Let's go to WDIV Local 4. Anyone at WDIV want to ask a question? All right. We'll go to Deanna Lights, WWJ.
Oh, when do you expect this deal to be finalized approximately?
We think it'll be finalized this year. Again, it's a non-binding letter of intent. So either party can exit if it does not work out. We're not predicting that, but it's always a possibility. But we're being very methodical on this. We're working on the next level of planning, which is not insignificant, and getting that framed up. And then you have the regulatory approvals, but we think we can get it done this year. But the exact timing of that is to be determined. By announcing this, we can expand the circle of people involved in it, because there's a lot of planning effort that needs to go into this to really make sure we validate and are comfortable with the benefits that Advocate, Aurora, and Beaumont will receive from coming together.
Okay. Let's go to Jay Green. Jay, do you have a question? Jay, we cannot hear you. I'll come back to you in a little bit. Okay. Let's go to Karen Buffard.
Can you hear me?
Yes.
Hear you loud and clear.
Yeah, unfortunately, I had a lot of trouble trying to get into the meeting, and so I just got in.
Do you have any questions?
I don't know where to start. I mean, I've missed everything that was just said, so maybe I can follow up with you later.
Okay, we'll come back. Let's try Jay one more time.
Mark, can you hear me?
Now we hear you.
Okay, you guys picked a great time to do this. I'm driving back from a camping weekend. Thanks a lot. It sounds like from the discussion with creating a holding company among the three organizations that this is a merger asset merger. The second part of the question is, there was mention in the release about financing. Will this create an obligated group, or is the intention to form an obligated group? And the third question is, besides what John said, some of the reasons for the merger, I wonder, John, if you could explain a little bit more why Beaumont would be interested in this kind of partnership. So that's it for now.
All right. Hopefully, I remember all three of the questions. Again, the mechanics of what's happening is that there'll be a parent organization that will be over the Aurora Corporation in Wisconsin, the Advocate Corporation that houses all their assets in Illinois, and Beaumont, which houses all the Beaumont assets. There's no plan to move assets from Corporation A to B. On the question of the obligated group, we are going to look at that. That's, we will be committed to helping each other. We think together we'll be a stronger credit. And the way you can take advantage of that is by having an obligated group as a traded credit out there. But that's going to be determined by what are our financing needs and timing in the market. Advocate, Aurora, and Beaumont have relatively low-cost debt in place, but we think our costs will even drop further together, and we'll take advantage of that. The timing of it is to be determined. That's going to be driven by our planning of our expansion and growth that we want in these various markets. And I think your third question was, what do we get out of this? Did I get that right? In terms of
Yes.
What would be the changes? What Beaumont gets, and I think Advocate and Aurora get, is once you get to this size and scale, we can materially invest more in a couple of things that we really just can't do separately. And I'll give you some examples. We believe that the patient experience with respect to interfacing with us, and frankly, our patient-facing IT and web capability is not where we want it to be. The other companies, Amazon, even Delta, in terms of what the customer needs, they do a better job of facing that customer with IT that's easy to navigate and is helpful. To build that, it really takes a lot of development dollars that are significant. But we think that Advocate, Aurora, and Beaumont together can start to pool those dollars and really spend the money on the development costs. Another area similar to that in terms of development is we've done well, but not as well as we can do, and I think ultimately should do, with chronic disease management. 75% of the costs in American healthcare are driven by chronic conditions of diabetes, hypertension, et cetera. And keeping those under control is critical to reducing costs. If we can take that and reduce the costs 10% or 5%, that's gigantic in terms of what it can do to benefit patients, employers, and others. But we need to invest in technology and new capability to do that. And right now, we just don't have the resources to do that the way we'd like to. But as we've modeled this and looked at it, the three regions together really do have the resources to make very large investments in that we think are going to make a material difference in how we perform going forward.
All right. I believe this is JC from the Free Press. This is a phone number. Is that you, JC?
Yes. Can you hear me?
Yep.
Great. Was hoping you could explain again. Hopefully I didn't miss this, but is part of this transaction, is one party buying the other, or how exactly does it work? And also, as a bit of a follow-up to Jay Green's question, when it comes to some of the business reasons for this deal, was hoping you might explain a little bit more about, you mentioned how you would be a stronger credit. Does that mean it'd be like cheaper to borrow money? And as part of that, I wanted to ask if you anticipate getting more leverage over insurance companies being bigger in the future than you are now.
Yeah, that's a big, what was the first part of your question?
Oh, who's buying who?
No one's buying anybody. And part of this is in the not-for-profit world, it does not work the way you think of in terms of the taxable world or stock. This is really more, frankly, technically, it's considered more of a pooling of interest, where the organizations come together and they go under a new common parent, and there's no money that changes hands. There's no sale that they take place. And in that common parent, they're under common governance, a common board of directors. As we've said before, this board will be equally distributed, with Aurora having 5 board members, Advocate having 5 board members, and Beaumont having 5 board members. And that board, subject to the terms and conditions that we negotiate in our definitive agreements, will have governance control over the entire operation. But with each of those markets, Illinois, Wisconsin, and Michigan, having, if you will, a 1/3 vote or influence over that. The second part of your question, I think, was the why. The other piece that we haven't covered is we're facing extraordinary, if you will, challenges from new players in the market that are much more disruptive. American healthcare and the hospitals and physicians are the most diffuse, disaggregated part of the healthcare economy. The pharmaceutical, device, insurance has all consolidated way more than the provider side has. And in addition, we have new players coming into the market: Amazon, Walmart, CVS, others, who all want to take a piece of the $4 trillion healthcare economy and either find a profit opportunity in that or become a new gatekeeper in terms of patient flow and work in that zone. And so we're facing a lot of challenges. And to do it, even though Beaumont Health is big at $5 billion, it's really not big enough to play with those kind of players. And we think that the three of us, these 3 markets together in the upper Midwest, and given our concentration being the leaders in our respective states, gives us an extraordinary opportunity to be more successful.
All right. I'm going to go back and see if WDIV had a question. Does anyone at WDIV have a question? No? All right. We will go to, Karen. I'll give you one more shot here. If you have a question now that you'd like to ask John, go ahead.
Yeah, hi, thanks. Okay, so first of all, where will this new board of directors, where would it be based?
Well, the board, I think 5 of them are going to live in Wisconsin, 5 of them probably in Illinois, 5 of them in Michigan. Where they meet, depending upon the frequency of meetings, I don't know yet. I mean, it's frankly, right now, everybody's having Zoom meetings through technology anyway. But, I assume they'll meet at the headquarters, but they also will do, I remember when we put Beaumont Health together, we moved the board around so the board could see, different parts of the entire organization. I wouldn't be surprised if that happened with this one. But again, they're not, the board of directors are going to come from the 3 legacy organizations, and whether they all live, whether all the Aurora ones live in Wisconsin or not, I don't know, but they're obviously going to have a connection with Aurora. The
Okay.
Advocate one's a big connection with Advocate through Illinois, and the
So it would
Beaumont
be
one's
similar.
Michigan.
So it would be similar to the way it is now with Advocate Aurora, where it's actually based in both cities, and so this would just be based in.
They move back and forth between Milwaukee and Chicago. I think that, frankly, when you start to, when you add a third player to the mix, I think it may call the question a little bit more for obviously a single headquarters, which geographically should probably be in South Bend, but I'm not sure that's going to make sense.
Okay. And then I wanted to ask you about, you recently decided against going with Summit, and there have been some discussions with Henry Ford also in the past for Beaumont. So it just seems that there's been a lot of exploration with a number of different healthcare systems, and I'm just wondering if you could talk about why this one might be more successful going forward than the others. And I also wanted to ask whether, this exploration, if that was the reason that you ceased discussions with Summit.
I don't know anything about that. We've had conversations with everybody in Michigan and surrounding areas, and that includes Tennant and frankly anybody else you want to mention. There's nothing going on or anything that particularly broke off with Tennant one way or another. And some of those conversations are frankly that we had, just general ones, were pretty dated or a while ago. The SUMA issue, again, is a very narrow issue. It was independent of Advocate Aurora. Whether we were moving ahead with Advocate Aurora or not, we would have made the same decision with SUMA Health. The SUMA Health people are great people, but when the pandemic arrived and certain, from our perspective, and financial realities associated with that, we tried to work through with SUMA changes to the agreement. We couldn't come to terms, and therefore we elected not to move forward. Again, I think the SUMA people were trying to do the right thing for their community and for SUMA, and we were trying to do the right thing for Beaumont. But for Advocate Aurora, they wanted to partner with Beaumont, with or without SUMA. And so it was totally independent of that.
All right, and we're going to take a final question, see if anybody at Fox 2 has a question. Fox 2, do you have a question? All right. Well, thank you very much, everyone, for joining us today. Thank you, John.
All right. Thank you all very much. I appreciate it. Have a great day. I know you'll probably have more questions, and we'll try to respond as they come in. Again, thank you very much. Appreciate your time. Have a good day.